So as doctors learn more about COVID-19, they are finding more side effects associated with the virus. One of the latest discoveries is called shock hair loss. It's caused by stress in coronavirus patients. So we brought in Cleveland Clinic dermatologist Dr. Shilpi Khetarpal. She joins us this morning with more. Doctor, thanks for being with us.
Thank you for having me.
Well, it's a shame that now we're hearing this too. Not only is it damaging internal things, we're talking about things on the outside. Talk a little bit about what shock hair loss is. What is triggering this? And then my second part to the question is that timing is crucial as well. Why is that?
Yeah, so shock hair loss is something we've seen for many years in dermatology. It's also called telogen effluvium. Essentially, what happens is any major shock to the body, whether it be fever or illness, like from COVID, any change in hormones. There's many things that can trigger it, medications, things like that. Essentially, what happens is a portion of the hair that's normally in the growing phase gets shifted into the shedding phase. So up to 50% of the hairs can shed instead of being in the growing phase. So timing is really crucial because of the hair cycle. We typically see it 2 to 3 months after the the cause. So for example, if someone was sick with COVID in March, we're seeing some of the hair loss show up maybe in June or July, just based on the natural hair cycle. It's also interesting that we're not just seeing hair loss from, people who have had COVID, but just from the stress of the pandemic, whether it be financial stress, psychological stress, just there's all types of stress about childcare, things like that. Any major stress, even emotionally, can trigger the hair to shed also.
Doctor, you mentioned the hair growth cycle. Can you go into more detail about how that happens and what the recovery is like for somebody that is going through this?
Absolutely. So it's important to know we have 3 phases in our hair growth cycle. So the first is the growth phase, which is called anagen, and about 80% of the hairs are normally in the growth phase. We have about 10% that are resting and 10% that are shedding. So anytime we have a major stress, this shift happens where the hairs go, get shifted up to 50% into the shedding phase. So, typically it's 2 to 3 months after the inciting factor or stress where we see the shedding, and it can last up to 6 to 9 months. Everyone's different, but about 6 to 9 months is how long it can last. So it typically does go away, but it can be incredibly stressful and distressing for people when they're seeing, hair in the shower, hair on their clothes, on their pillow. It's just massive amounts of shedding.
But the good news is there is a recovery. This is not permanent.
Correct. It is temporary. Like I said, it lasts a few months. Typically, it's less than 6 months, and all the hair does come back. Okay. But as people know, it's a slow process, sure. And then it takes time for the especially for women to see that length and fullness back. But it does come back, and the good thing is that it's not scarring.
And again, this is not just for COVID patients. This is we all deal with this. What are some of the other things that are high up on the list for other things that we're dealing with in life? I know probably stress is at the top.
Absolutely. Other times we've seen this. So anesthesia, like from general surgery, can cause it if people have had any surgeries. One of the biggest factors or common things is postpartum. So after childbirth, the change in hormones and the stress from delivery. Other medications, there's several medications that can cause it. But, even with like the flu or any kind of fever, it doesn't have to be COVID, but any major change or stress to the body, a death, a divorce, any major stress in life can certainly trigger this. And the key is, giving it that 8 to 10 week delay in that you see it from the hair, and then it typically lasts, I would say, on average 3 to 6 months, and then the shedding stops, things go back to normal, and it's just something in the past.
So doctor, what are some of the things we can do to protect our hair?
Sure. So, a couple things. Number one, eat a well-balanced diet. Make sure you're getting enough protein, because when the hair is done cycling through this, you need enough, protein to build those hairs. Make sure you're, eating enough fruits, vegetables, take a multivitamin. If you're not someone that eats red meat, maybe look for a multivitamin with iron. Other things, like over-the-counter minoxidil. 5% minoxidil is a liquid or a foam. As long as you're not pregnant or nursing, you can use that. That actually shifts more of the hairs into the growing phase. But, overall, like if it's not getting better in 6 months, then it's probably a good idea to seek medical attention and see a dermatologist, because there's other things we can do if those simple measures don't work.
All right, Dr. Shilpi Khetarpal, thank you. Thank you for your insight. We appreciate it.
Thank you so much for having me.